Good evening. For the benefit of members of the public, I'm Hal Bulliston, Portfolio Holder for Public Health and Community Wellbeing, Leisure and Culture, and Chairman of this board. A very warm welcome in these difficult times. I will be assisted today by James Townsend as clerk for the meeting and by Phil Rumans, who is the Zoom host. I will now ask James Townsend to display some reminders about how we conduct meetings via Zoom.
Chair. In addition to these points, if it becomes necessary for members to telephone into the meeting, you will not be able to speak. So once everyone who has raised a Zoom hand has spoken, the chairman will ask anyone who's telephoned in to speak in order. Any voting necessary will be done by show of physical hands. If we need to adjourn the meeting for any reason, then the chairman will advise the board of the revised time and date of the meeting. If it is a short adjournment, you will be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be set. Do members have any questions about the way in which this meeting will be conducted?
Thank you, James. Do we have any apologies?
Just the one today from Tessa Linfield.
Could we therefore go to the minutes of the previous meeting dated 23rd October? Any issues, comments from anybody? In that case, I will sign the minutes.
Chairman, sorry, I have got my hand up.
I do apologise.
I was just going to ask a question with regards to an individual communication out to early years settings. I don't know if that happened, or I don't know if we want to pick that up in the comms piece.
Yeah, from comms.
It was a point that I raised on, I think it's on page 8 of the minutes.
And do you want to come back to that later, or?
I can answer that now. I'll be honest, it kind of slipped off my list, I'm afraid. I think with everything that happened sort of last week and half of last week, the week before. But I've noted it and I can carry that one forward.
Okay, thank you.
Anything else? Do we have any declarations from members? In which case, I'll move on to Matt to provide the situation report on COVID.
Thank you, Chair. So as always with these meetings, I'm just going to run through a few slides just to give the latest position in terms of what the data is telling us in West Berkshire. These slides were pulled together yesterday or early morning this morning, so it won't have the latest data that's just been published by the government on their COVID dashboard. So as many of you will know, and those watching, all local authorities now in Berkshire are following the new national restrictions from Thursday, the 5th of November. So as things stand, this has replaced the local 3-tier coronavirus alert system. The expectation is that we'll revert back to this local alert system from the 2nd of December. If people want to find out more in terms of what the new restrictions are, what they mean, what working from home and business closures mean, why they're being introduced, then there's a link at the bottom of this slide that people can go to. A variation of this presentation, I'll refer to at the end, is now available online, and I'll refer to that at the end so people can actually follow up and click on these links if they choose to do so. So in terms of where we are in the weekly rate per 100,000, so this table many of you may be familiar with. We have each of the local authorities on the left hand side here. I'll just go through each of the columns one by one. So in terms of the number of individuals tested per 100,000, West Berkshire's lower than the
Matt, you're on mute.
Sorry, my network just dropped then briefly. Apologies for that. So I don't know if you caught my first part. I'll just move on to the positivity.
We haven't got the your presentation up on screen now.
Okay. Okay, apologies for that. I think I completely dropped out. So in terms of positivity, our rate is about 6.3. And in terms of these colours, they just refer to Public Health England in terms of how they categorise positivity. So anything less than 5 is green, between 5 and 7.5 is amber, and above 7.5 is red. And again, what we mean by positivity is a proportion of those that have a test that test positive. And it's a good indicator to see actually whether the rate of infection is increasing rather than just testing more people. In terms of the cases per 100,000, West Berkshire is at 104.8. So again, it's still lower than the regional and the national average. Clearly areas such as Slough, Windsor and Maidenhead and Reading have significantly higher rates than us. Interestingly, and I'll talk about this, we've looked at this over the last few weeks now in terms of the cases per 100,000 for those that are 60 or over. What we have now seen is that starting to increase in West Berkshire. So some of you might recollect maybe 4 to even 6 weeks ago, the numbers within this age group were quite low, but there was always a worry that as infection rates would increase, it would start to affect the older age groups, which we know are more vulnerable in terms of health complications from COVID. So that's now at 97 per 100,000. In terms of the number of cases in the last 7 days, it's about 166. This map's a little bit out of date now from when this was published. In fact, only Wokingham now are currently less than 100 cases per 100,000 per week. So all of Berkshire are now 100 plus or more. And again, obviously those towards London having a higher number of infections than ourselves. In terms of the weekly rates, it's quite a busy slide, this one, but there's been about just under 9,000 confirmed cases of COVID-19 in Berkshire to date, and 47% of these have occurred since the beginning of October. Each of these graphs just represent the local authorities in Berkshire. West Berkshire's here to the left-hand side. At the bottom of these graphs, we've just got the dates. And then to the left-hand side, we've got the weekly rate. The grey line represents the national weekly rate. The orange line represents the southeast weekly rate, and the blue line represents that particular local authority. So again, West Berkshire, again, just lower than the regional average here. Places such as Windsor and Maidenhead, Slough and Reading slightly above that. What we are starting to see with the cases is that they are starting to plateau a little bit. So there is some signs that the cases are leveling out. So we're seeing in the region of anything between 15 to 30 cases each day. And we're hopeful that with the national restrictions in place, that will remain the case and hopefully reduce over time as well. So again, this is for Berkshire. 10% of cases were confirmed through Pillar 1 testing. So these are the testings that take place in hospital, and 90% through places such as Newbury Showground. A fairly even split between males and females. And again, we just need to be careful in terms of, because this is Berkshire, 53% were from white background, 30% were from ethnic minority groups, and 17% had no ethnicity information recorded. I just wanted to go back to that age group point which I made, and again another busy slide, but all we've got here is the age groups, so 0 to 15 on the left hand side, 16 to 29 and upwards, and then we've got the dates along the bottom here, and then it's just got the rates of the rates of infection per 100,000 for each of these age groups. So again, it's just emphasizing the point really. Right at the beginning of October, September, it was very much focusing on 16 to 29-year-olds, where the vast majority of cases were. And over time, that proportion of that age group is reducing. And as you can see, as we move up the age ranges, it's starting to get darker shades of orange. So again, as I talked about earlier, the 65 age group now, they slowly started to increase. It's 111 here, slightly different age ranges, but I think it gets the point across that everything we do is really, really important to stop that rate of increase amongst the older population. And again, you can also see that being reflected in the 45 to 64-year-old age group. So again, we always just tend to look at the data at the mid or super output area. So again, these are geographical areas that cover populations of between 5 to 15,000 in West Berkshire. So we've just got the number. This is between the weeks of the 23rd to 29th of October in each of these MSOAs. And then this on the right hand side equates to the rate, so the per 100,000, and that's just to standardize it so we can actually compare between each of the different MSOAs. So again, as always, there's no major standouts MSOAs, but we're keeping a close eye on that and seeing whether any of these areas need any particular support. Again, where there isn't a bar, that just means there hasn't been any cases or less than 3 cases in that week. And again, with the deaths, sadly, there's been 137 COVID-related deaths in West Berkshire during the pandemic, and 2 deaths were recorded for the last 2 weeks. And again, with this chart, I think it's not just COVID-related deaths we look at, it's something called excess mortality. So it's where we feel there's a higher number of deaths than what we would expect compared to the last 5 years. And that just gives us an indication whether it's COVID-related or other unintended consequences. So since March, our all-cause mortality rate has been 24% higher. But we're roughly averaging a death every week at the moment in relation to COVID. In terms of the hospital activity, again, we're only able to share data with regards to southeast data in hospitals. And I think really the key message to take away is that we are continuing to see a rise in admissions and those with COVID in hospitals. Clearly that's a key driver in terms of why the national restrictions have been put in place. I guess the other point I just want to make at this point is that whilst we are in national restrictions, I think it's really important that people continue to access health and care as they need to. So the NHS is still very much open and we want people to continue to use the service as they would and make sure they get the right care at the right time. So just moving on to contact tracing, I know this is further on the agenda. So this is data up to the 9th of November. This is just for the 3 local authorities in Berkshire West, so to the west of Berkshire. What we see that in terms of the percentage of confirmed cases that have actually been contacted by the National Test and Trace Service, we're all in the region around 80%. So that remains really positive because we know that SAGE recommend that 80% is that minimum threshold for test and trace to be effective. And I'm sure we'll talk a little bit more, as I say, about test and trace further on the agenda. And then in terms of the percentage of contacts completed, so that's of those individuals that have tested positive, what proportion of those of their contacts have been followed up, and that's around 70%. I'll move on to the next agenda item, if that's okay, Chair, just to talk a little bit about the outbreaks and incidents. So again, we're still seeing quite a significant number of incidents and outbreaks and clusters across West Berkshire. We're dealing with quite a lot of isolated exposures in schools. So that's where there's normally just one within the schools across both primary and secondary schools. In care homes, again, we're seeing a number of incidents within care homes. These are largely identified through the regular testing that's being undertaken in care homes, and quite a high proportion of these are also staff. But we're again, where all these incidents and outbreaks are identified, we're putting in our local outbreak control plan in place. We're doing infection control visits, and we're making sure all the control measures are put in place as appropriate. And there are also 2 workplaces, none in health within West Berkshire, but we know there are some incidents and outbreaks within RBH, Royal Berkshire Hospital, and others within some specific wards, but again, they're being well managed. And then there's 3 in other identified settings. So in summary, we've had 1,239 confirmed cases to date, and 166 of these have been over the last 7 days. As I said, at the moment, things are starting to plateau, but we're keeping an eye on that. I don't think we can take anything for granted. We need the public to continue to do what they're doing. We really appreciate all the support and work that they're doing around that. The weekly rate is now over 100 per 100,000. And there's been 2 deaths recorded for the last 2 weeks. And then since March 2020, our all-cause mortality rate, so in terms of the number of people that have been dying, has been 24% higher than the previous 5-year average. and this equates to about 176 additional deaths. And we continue to see a number of outbreaks across various different settings, and the council's working hard to support those settings with colleagues and partners. And then finally, I think we will just have to wait a couple of weeks to see what the impact will be from the national restrictions and what this will look like on the infection rates. And it will take a little bit further down the line to actually see what the impact will be in terms of death rates as well. Finally, I did just want to make everyone aware that the Berkshire Public Health website has been updated quite significantly over the last week, and further updates will be made this week. Many of these slides and similar can be found by the public going onto this website and clicking on the information centre icon here, and they'll be able to download weekly slides. They might be slightly different, but again, the key takeaway message will be on there and the key data. The other thing that's now available on the website is that residents can put in their postcode, and it tells them what current restrictions they're under, what they can and what they can't do. So that's a really helpful advice pages for the public to access. And again, the public can go onto the government website to get further information. That's all for me, thanks.
You're also down for local alert system, Matt, is that?
Yeah, I think that's a bit redundant now because this agenda was published before the national restrictions
Okay.
come in, so I think we can probably park that.
We'll move straight to item 7 in that case, which is contact
Sorry,
tracing.
Chairman, I've had my hand up for a while.
I do apologise.
I have no questions. I just want to offer my apology for somewhat unseemly departure from the meeting earlier on due to IT problems.
I also see Councillor Vickers, then Councillor Bridgman.
Thank you. I might have sort of missed it in the presentation, but the last meeting, the private meeting, Matt, there was a very low figure for the increase in over 60s in West Berkshire, and he was going to go back, I think it was 30 or something, compared to over 100 in other areas, and he was going to go back and check that. I see it's 90 something now. I mean, was that figure correct, the one last week, or?
Yeah, no, it was Councillor Vickers. I think these weekly rates can change quite quickly. So I did speak to some further colleagues about what might have led to the lower rate for 60 plus or more compared to other local authorities, and we couldn't really put our finger on it. Clearly now we're level with all the other local authorities, so sometimes it could be a data anomaly. I don't think it was in that case. It could have been that we are just maybe 2 to 3 weeks behind the other local authorities. But that has obviously sadly increased, and again we just need to keep an eye on that going forward. And we need individuals of that age, they need all they can to protect themselves. They really need to vigorously follow national restrictions, seek the support that's available through the community support hub, seek the support of friends and families. So no, it was really difficult to understand why that was the case, if I'm honest.
Thank you.
Councillor Bridgman.
Thank you, Chairman. Matt, am I correct in thinking that go back at one of the early, possibly the first chart you put up, showing the rate per 100,000, that the proportion of the 0 to 60 population as a percentage of the 100,000 as opposed to the entire population is increasing in ratio? My recollection is that when we looked at these numbers last time round, whilst we were up in the sort of, I think, the 70s or 80s on the 0 to 100,000, we were down in the 30s to 50s in the 0 to 6 in the 60 plus. So is there an issue there?
I don't think so. I'll just share my screen again. Sometimes I think it's a bit helpful to talk through. So I guess as a proportion, you can see the rates in this, this is 65 here, has gone up. So I can take that away in terms of what the proportion looks like. But I mean, it's a worry. I guess what we know in public health, it was almost inevitable, unless I just think it's always going to go up the age groups, the way that people meet up with one another, family and friends see each other. It's almost inevitable that the infection rates will reach the older age group. So as a proportion, I could probably take that away and have a look. I'd imagine they are, as a proportion, it is increasing. But I guess, yeah, we just need to be guarded about that. And as I said earlier, we just need to make sure that those individuals take those extra precautions. We know that shielding from the national government, that can lead to a number of unintended consequences. So we're not saying to older people to lock themselves away. We're just telling them to be more vigilant would be my advice going forward, and just to take that extra care and follow the national restrictions. Does that answer your question?
Indeed. Well, indeed. And one of the reasons I asked the question is because my perception is that the older age group are more likely to perhaps follow the rules more rigorously, if I can put it like that. And certainly so far as care homes are concerned, obviously there's a huge amount of work's gone into infection control and controlling visiting and so on and so forth. So just to understand and, if necessary, anticipate issues that might be coming along, because obviously a lot of this is to do with the messaging and ensuring that our residents are aware of issues that are coming forward over and above the general rules that the government puts out. Just wonder whether that's helpful if we're going to continue to try to suppress the virus.
Yeah, no, I think you're right. I mean, what we also know is that most of the transmission takes place in households. So that's likely where a lot of this transmission has started. And what we know from the national restrictions, obviously that's preventing household mixing. You know, that's one of the most important things they put in place, because they know that probably have quite a significant impact for those age groups. So yeah, I think we can maybe pick that up under the comms piece in terms of how we communicate that. I'm happy to think about that.
Councillor Masters.
Thank you, Chairman. Thank you, Matt. In terms of the incidents and infections that we've got in the area in and around the care homes, how is that broken down in terms of council staff, agency or temporary workers? I know there's been some tightenings of controls in the past. Is that holding up well?
Yeah, I don't have that specific data on me in terms of the breakdown. My understanding is it is holding up well. We are seeing those odd occasions of some cases, because obviously staff will, socialise outside of homes, household mixing and things like that. So generally, we feel the infection control measures are pretty robust. And obviously, we're now working at looking at what those what the new care home measures look like going forward as part of the national restrictions. But a lot of work has been put in place both to prevent and respond to an outbreak. So we have regular kind of visits into care homes. We review how care homes are doing. If there is a single a case that's been identified through regular testing, then again, we put in place those measures quite quickly to prevent further spread. I don't know if Andy, if you wanted to come in on that at all.
Thanks, Matt. Yeah, I think you're absolutely right. The infection control arrangements that we have in place across care homes in the patch is really strong. We've invested additional capacity and resource into infection control nursing to work with providers to make sure infection control arrangements are robust. And obviously we track the position in the care home, tracker returns that we get on a weekly basis. So we're in a strong position, but obviously it is a challenge, particularly as the rates start to increase, but we've got a very close eye on it with our partners in the private voluntary independent sector as well.
Matt, can I ask you?
Thank you.
The excess mortality figures, they're clearly being distorted by what happened in March and April. If we actually took them on the last 3 months, let's say, next time round, be interested to see what happens.
Yeah, I mean, as things stand, and looking at that data, the current death rate is level with what we would see at this kind of year, at this time of year. So, as things stand, we're not above that 5-year average in terms of statistically significant data. So we just need to keep a watchful eye on it. I think we know that obviously treatments are better now in hospital, and we're getting better at supporting those that get seriously ill. So we will just have to wait to see. And like I say, with the national restrictions, hopefully that will have a positive impact to prevent any more people dying.
Okay, I can't see the blue hands up, so perhaps we move on to contact tracing, which I think Sean's going to present to.
Thank you, Chair. I'll just share my screen if I may. Can we see that?
No.
Okay, let's try again. Okay, that one.
That's better.
Thank you.
Just need to go on the main screen now. That's it. Perfect.
That's great. Thank you. So at previous meetings of the Outbreak Board, we have discussed the concept that we were going to move towards local contact tracing. What I was hoping to do tonight, Chair, is to just give a quick update as to where we've got with that and the next stages. So we have been working on this for several weeks, and last Monday we got approval for West Berkshire's local contact tracing offer, I suppose, to go live, which it did do on the 5th of November. I'm pleased to report that the Public Health England, in their assessment, gave us rated us with a high degree of confidence in respect of our ability to deliver in this area. What is local contact tracing? Well, in essence, it is a partnership with Public Health England and the National Tracing Scheme. And the idea is that it doesn't replace the National Tracing Scheme, but basically complements it. And in effect, the remit of West Berkshire Council is that in local tracing would be that effectively it would look at those cases which have not been traced by the national scheme within 24 hours. So effectively a number of attempts are made by the national scheme to contact people to collect tracing information from them. If they're unable to do that, then basically within a given period of time, those cases are referred electronically through to the local authority, and they're picked up by us to carry out local tracing. And in terms of its development in West Berkshire, it was developed and implemented by a cross-service project team led by the Public Health and Wellbeing team. And I'm very grateful to Catherine Greaves, who did a lot of work in terms of supporting that, but also grateful to colleagues from the Hub, from ICT as well, because obviously getting elements of this right, there was quite a bit of work in terms of telephony and everything else that went alongside this. It is managed now by the Public Protection Service on a day-to-day basis, and we have around about 30 officers in total trained. These are officers who are doing this basically not full-time, obviously. They're doing this on a rota, and they include basically a number of levels in that. So you've got the data super users, who I'll come on to and explain the different roles in a minute. The people who are responsible for each of the shifts, as it were, and then the call handlers. These are the people who are actually making the contacts with the local cases, basically, and hopefully having made contact, collecting, tracing information from them and putting them back onto the national system. So phase one, which is where we're now in, basically includes phone calls made to local cases. We have a maximum number of calls that we make, which is 3, basically to them. We will leave voicemails, and we're able to basically follow that up with emails for welfare support if needed. Currently, the service operates 7 days a week, and it's operating between 9 o'clock, primarily and 5 o'clock, but it does depend actually when we get the data through. So at the moment, the aim of the national system is to have the data to us by 10 o'clock. Most days it does arrive significantly earlier than that, but we have had days where there have been glitches where the data has not arrived until the afternoon, in which case it's picked up basically either in the afternoon or the next day. So how does it work? Well, in effect, there are 2 systems that are used by the national service, which effectively we now have access to on the basis of a data sharing agreement. So effectively, the case details are securely downloaded from the National Test and Trace system into a local file. And a small number of officers within the authority have access to that. Clearly, that's sensitive data. They look at that information, download it, and then basically the team leader, whoever is managing that on that day, basically allocates those cases to a particular call handler. The call handler then calls the residents, advises basically on the importance of self-isolation, the other messages that basically form part of the national messaging on this, and then completes the contact tracing data. That data is then basically uploaded onto a national test and trace system. So effectively it's downloaded off one system, goes through to the call handlers. The call handlers basically make the calls, collect the data and load that data onto the same national system that obviously is used by NHS and PHE. Where necessary, we're having not where necessary, but we are having the discussion at the same time as to whether basically a particular person needs any support or welfare support, and we're gathering information about that, and where necessary with their agreement signposting them for welfare support. So what are the benefits of local contact tracing? Well, obviously one benefit is it comes from a local number. And certainly the discussions I've had with the staff that are doing this work is that nobody at the moment, they've not come across anybody that's surprised to have actually heard from somebody from the local council in this capacity. I think there is a recognition of the role of West Berkshire Council, or in any local council, in delivery of this, and obviously phoning and saying I'm from, environmental health, or if it's from public health or whatever, basically people do recognise those as local brands, and particularly the council as a local brand. So that's one benefit, as well as having the local number. The other key ones basically are that we are able to signpost, as we've said, to local sources of welfare support, and to enable a household to isolate. And that's something obviously that we can have, that's the added value over and above that provided by the national system. And then we're obviously able basically to access other information should we need it to basically to contact people. What I would say is that certainly we have been doing this for a few weekends for Wokingham. As I say, we started in West Berkshire last Thursday given that these are cases that have been referred to us because the national system hasn't been able to get hold of them, I think we're off to an encouraging start, and I suggest that future meetings we could perhaps come back with some of the data around the success or otherwise basically of local tracing, because I think that would be helpful to see basically what we are picking up and how far we're able to extend the benefits of the national scheme. So just moving on to really, I suppose, what's phase two, we are looking at options that some other authorities basically have already instigated, and we're looking at those very, very quickly now. One of them is basically an option around evening calls. So those are evening telephone calls, and maybe at some later stage, basically also door knocking if that becomes necessary, effectively visiting people in their own homes. Basically to try and obtain that data. I think the next stage, though, primarily the first step will be basically evening calls, because the information that we've had talking to colleagues in other areas is that is quite successful, and certainly the weekend tracing seems to be relatively successful as well. So that's my update on this, and as I say, I propose that we come back at a future engagement board, perhaps give it a couple of weeks, basically see how it's going and feedback basically on the effectiveness and perhaps some of the data locally. Thank you, Chair.
Thanks, Sean. I can't see any blue hands. Oh, there are, sorry. Councillor Vickers.
Thank you. Yes, Sean mentioned 30 extra people doing this contact tracing. Is this existing council staff, or are these additional people that we've employed?
No, these are, so what's happened, Councillor Vickers, so we sought volunteers. So we have basically a couple of staff that were former Hub member staff or currently Hub member staff who are doing some of this tracing during the week. What I did was I sought basically staff to come forward basically to train, to help fill the rota in the weekends, but also with a view to the fact that we would also basically have people on an evening rota at some point. So effectively what we've done is these are existing staff, primarily they're public health staff, they are environmental health officers and other people that work within the Public Protection Service, that they are Hub staff. And in fact, we've also got one member as well on that rota. So effectively it's not, none of them, it is their full-time day job. This is basically, they're rotated in.
So they're volunteers, did you say? But
no, they're not volunteers. They're council staff who have other jobs. So effectively, they are people like environmental health officers and public health professionals. But effectively, during the day, currently a lot of the calls are made by what were the Hub staff. But going forward, basically, and the weekend rotas are staffed by a combination of public health, environmental health, training centres, public protection staff, basically.
Thank you.
Councillor Doherty.
Sean, is it worthwhile saying how those phone calls will identify themselves? Because obviously you're conscious about people having phone calls coming in from a 01635 number, but is it worth saying a little bit more about how residents can be sure it is a council member of staff ringing for a specific purpose?
Yes, thank you, Councillor Doherty. Yes, basically it comes across as a. I think Catherine can confirm. I believe the number is the main 551111 number. So you know that basically it is a phone call from West Berkshire Council. Clearly, obviously, we can confirm that by email if people need us to do that by using a council email address to confirm our involvement. I understand exactly where you're coming from in terms of concerns about people putting themselves forward. Basically as being contact tracing, and we know that basically there has been issues nationally in relation to some of that. But yes, I mean, this is one of the real benefits of it. It is a local number. When they phone back, basically they phone back, if we leave a message, they phone back to a West Berkshire Council number as well, which has been specifically set up for taking those calls. And that is one of the benefits.
Councillor Viggs, is that an old hand?
Yes, sorry.
Councillor Masters.
Thank you, Chairman. Just congratulations on the team for getting this set up. I think it's been much needed locally. I'm just wondering, in terms of the profile of the Serco test and trace that we've been using nationally, what have been the reasons given by members of the public that they haven't responded, or is that not something that's been logged?
I think it's fair to say actually that certainly, as I say, we've got a bit more experience in the last few weeks as well for covering some weekend tracing with Wokingham. I mean, there are some people basically who they were just not able to get hold of. I mean, they make 3 calls. I think maybe people were reluctant to answer at national level because, if, for example, the number wasn't recognisable as something local. I mean, people are quite, you know what, people could be quite have views on basically telephone numbers from unknown numbers, or telephone calls from unknown numbers. I think it's also fair to say as well, just talking to officers, that there are people who perhaps don't want to be contacted and who particularly don't want to cooperate. I mean, I think the idea that basically, I think they have come across that, not necessarily with the West Berkshire calls so far, because we've only been doing it a few days, but we have had incidences where people do not want to share contact information with us. And I think that is an issue. I mean, Matt may know, may have a bit more.
Have you got any numbers on that, Sean?
I haven't. I mean, again, maybe what I could do when we come back with further data to future meetings, we could give some indication both about the success and the level of cooperation.
Excellent. Thank you. Thank you,
Matt,
Sean.
have you got any more? I mean, this is an issue, I believe, nationally, isn't it? That there is, just a small proportion of people who aren't necessarily cooperative.
Yeah, I'm not sure about that. I mean, I know that, we know that a lot of people don't self-isolate when they're asked to. A lot of the studies that have been done nationally, it's nearly as high as 4 in 5 people who maybe have been a contact don't necessarily choose to self-isolate. And that could be a whole host of reasons, whether it's around childcare, whether it's about worries about income, or that actually, they're not at risk. So it's really complicated. And I think that's something for us as a board to go forward to, thinking about how we actually reach these individuals that don't want to isolate. Is it that they need financial support? Is it they need caring support? Is it, all these kind of things and this is why it's so complicated. Every individual is different in their own circumstances and context. The only thing I was going to add to what Sean was saying was, one of the benefits of local contact tracing is that actually some of the data is reported to test and trace. They don't have the right contact numbers. So they might have a digit missing, their address might be wrong. And that's where local contact tracing can help, because then we can look at how we can match those records to our own databases so that we can actually contact those people and inform them that, who their contacts are and so forth. So I think that's a real benefit of local contact tracing.
Chair, can I just add to that? I mean, what I would say is, certainly from our early involvement with this, is that I talk about basically sometimes people not wanting to share necessarily information, but the vast majority of people are cooperative. If we get hold of them, people basically, are assisting in basically with the tracing process, and actually basically are happy that that they've been contacted and able to have that kind of discussion with officers. I mean, the calls can actually take quite some time, actually. I mean, I think we've been quite surprised talking to some of the officers doing this, that it can be a few minutes, or they can take up to an hour, basically, by the time you've actually been through it all. But I think we'll have a much clearer picture of where we are with the West Berkshire tracing work, basically, if we just give it perhaps till the next meeting.
Thank you. Councillor Berg.
Thank you.
Thank you, Chairman. I had a correspondence with Sean earlier on this morning. It's been reported nationally that the national scheme can end up with individuals receiving 10 or more calls a day, and that's driven a degree of reticence to answer the calls, and people have been blocking the numbers, etc. So I'm really pleased to hear that Sean's and the team, they've preempted this by restricting the number of calls to an individual number to 3. I think it's a great move. Thank you.
Thank you, Councillor Belk. And what we've also found as well, sometimes as well, that they're not able to take the call in the first instance. So what we have done in those circumstances is arranged to ring back at a set time, which I think is also more positive. But yeah, I mean, we certainly don't want to get into that routine of, bombarding people with calls. And I think that's part of the kind of issue sometimes, where they've not been able to get a hold of people. I think they may have, that may be part of the problem.
I can't see any more blue hands up, so could we perhaps move to Mandib on communications, please?
Sure. I'll just give a bit of a comms update for everybody. So we had to obviously change our focus from the announcement about the national restrictions, and so we have gone forward with that and communicated this out to residents. We've sent out 2 newsletters, a week note from Nick and Lynn as well, got sent out. We've updated all of our social media posts, we've put it all in the hub bulletin, we've updated the website, and we've also been answering press inquiries about kind of how this works on sort of a local level. So we've been moving forward with that. On Friday, we communicated out quite quickly about the business grant support as well. That was via a press release and a special newsletter to businesses, updates to the website and social media as well. And there should be an interview going out tomorrow on BBC Radio Berkshire about that. The COVID residents newsletter has gone out today, and that goes out to just less than sort of 40,000 subscribers that we have on the distribution list. And I would just encourage anybody in the public who's watching who maybe doesn't receive this newsletter to actually sign up to it, because it's a weekly newsletter that goes out, gives an update about all of the services, within the council that have been affected by COVID, but also other bits of information that are probably really helpful to kind of get an understanding around. If you go to the main website and scroll down to the bottom on the footer, there's a little icon with an envelope on it. Just click on that and that will allow you to subscribe. But we've also got other newsletters available as well that we're trying to kind of build up a distribution list for. So it'd be really helpful for people to sign up to that one. As mentioned earlier about local contact tracing, we did we launched information about that as well. And again, that was done via press release, a website update, social media. It's been in the residents newsletter and in the hub newsletter as well. And we also sent out some comms around the dashboard that Matt showed for the Public Health Berkshire, and that went out again via our normal channels. Coming up, we've got some flu and COVID messaging coming up over the next few weeks, obviously highlighting the importance of getting a flu jab for those who are in a vulnerable position. We are continually putting out messages with the new national restrictions, and we'll continue with local contact tracing and the dashboard as well. I just wanted to point out on the local contact tracing, we've got a web page that's set up about that on our website, and there is a privacy policy on there and an FAQ document as well for people who just want to know a little bit more about it. We are also sending out a leaflet to every household, and that's due to go out on the week commencing 23rd of November. We're also looking to have that leaflet translated as well to help those out in the community. We've got messages to the community via the hub that kind of continues, and also working with our partners as well on that one. We've also changed the homepage of our website so that it comes up at the top with information about financial help for people who have been affected by COVID. So I think that'll be really helpful so that people can find information a lot more easier. We've also added a service update to the website on our coronavirus page, which talks about the council operations during this national restriction. I think that'd be really helpful for people to understand, you know, what's still going on, what's changed, and what we've had to adapt. We're also looking to change our messaging on the radio advert that we've got out, and my colleague Paul is going to be looking at that. So it's more about the messages for the national restrictions. And then we'll go back to kind of the alert level. And finally, on Tuesday next week, we have a Facebook Live with Lynn, and that will be talking kind of a Q&A session about the ongoing response to COVID. So if people have any questions that they want to submit for that, they can do that by emailing pr@westberks.gov.uk. And that concludes my comms update.
Thank you, Madam. I've got Councillor Vickers, then Councillor Doherty.
Thank you. Thank you, Mandit. We've been talking quite a bit about our concern about the numbers going up in the elderly population. Obviously, these are the ones most at risk. Can we think about having something targeted for them? Now, I feel like a stuck record, but I've a few times said that, you know, we know where some of our elderly population are, i.e. in sheltered accommodation and in blocks of purpose-built accommodation. And, you know, I know that some elderly people are treating the block as if it was their home, rather, you know, and not wearing masks in public spaces. And we hear that hotels are, you know, have got the message, although they're closed now, and they would be instructing people to wear masks in public areas within their hotel. Well, these blocks are just the same. They're like hotels. So I'm assuming we would have the contact details for these private blocks of accommodation. I know we haven't got any particular links or jurisdiction over them, but we could at least be encouraging and informing them. I know otherwise it's difficult to target our elderly population, but, you know, could we maybe be making a special effort? We've got a leaflet going out, a general leaflet. Again, that's another matter. Are we going to be able to see this leaflet? But I think in as regards the elderly, we need something just simple and targeted at them. I know quite a few elderly people in my, well, I'm not too young myself, but some very elderly people in my area, and they're getting a bit weary of all of this. People who've shielded before, who are not particularly shielding, but they just wish it was all over, and they might be relaxing their guard or just, you know, so a little something that's encouraging for them and saying, hang on in there. I mean, we've heard about the vaccine, which is a good thing. That's just hot off the press. So maybe that'll give them a bit of bounce, but also that might lead to some people thinking, oh, you know, maybe it's all over, and relaxing their guard a little bit. So that's another message that I'm worried that we need to get out there, that, you know, this is important, that we're even more diligent now. Now that we know that we might have a vaccine in a few months' time. Don't relax, keep going. So it's sort of something sort of morale boosting, but a bit more targeted at our risk populations.
Sure.
Councillor Doherty.
Thank you. Thank you, Mandit, for all of the work that you've done. I think there's been a vast amount of communication come out in the last week or so, particularly since the national restriction. So thanks to you and the comms team for doing that. It's much appreciated. I'm smiling because of the leaflet, and obviously I have seen the leaflet. I think it was actually brought before this board, so we've had the opportunity to do it. Just confirmation that the information on that leaflet contains a telephone number as well as an email address, so that anybody that hasn't got email access can still telephone in. I believe that's on the leaflet, but could you just confirm that?
Yes, on the back page there is a lot of contact information on there. So it is a mix of, you know, kind of signposting people to the website, but we have also got telephone numbers on there for kind of our main contact centre for the hub, and also email addresses as well.
Okay. And also, as far as distribution is concerned, I understand it's going to every single household, including flats and blocks of flats across West Berkshire, but it might also go into some of our surrounding areas. And I don't know if it's worthwhile just letting residents know that those on the border might receive, but have we put some information on there for what they should do?
Yes, so our border is obviously different to kind of the Royal Mail border. So yes, there will be some crossover, but on the back, we have put a little caveat on there to say, obviously, if you are on the borders, you will receive this, but we've then listed the telephone numbers for all of the other local authorities that border us.
Okay, so are you confident with the radio, newspaper, social media, website, leaflets that we'll be reaching as many of the residents of West Berkshire as we possibly can?
Yes, I am. I'm sure that there's probably more that we can do, but you know, the leaflet itself, just to kind of put a caveat around that as well, is that we are going to do some like kind of drip feeding messaging to let people know that to keep an eye out. But obviously, people might not even know it if they're not following us. So actually, I would kind of encourage everybody to help maybe share that message if they can, and we'll start drip feeding that from next week, just to let people know, because people might accidentally throw it away, or they might not realise that they're supposed to expect it. So yeah, I think we are trying to kind of get to as many people as possible, definitely.
Okay, thank you, Mandip.
I can't see any more blue hands up, so any suggestions for the next meeting for the agenda items? If not now, perhaps you could advise James as we go through the next week or so. Any other business from anybody? No? If not, then I think all business is now being concluded. Thank you to everybody attending, and particularly members of the public.
Chairman, Councillor Vickers has a hand up.
Oh, I'm sorry, I thought it was an old one. Councillor Vickers. I'm sorry, I thought it was an old hand.
Very briefly, just going back to the leaflet, I just put a message in there saying it would be nice for it to be forwarded so we can have a look at it, you know, before it goes out, if that's possible. I do remember it being discussed at the last meeting and we had a quick glance at it, but I quite like to see it. There seemed an awful lot of information there. What I wanted to ask was, and I don't know whether it's something we could bring to a future meeting, have we got any feedback about the effectiveness of the previous leaflet? Are we doing anything like that? Any sort of, because, you know, we're spending money on sending information out. We sent one out some time ago near the beginning of all of this. Did you get any feedback about the effectiveness, about how useful people found it, about what information they picked up? Did they, you know, is there any feedback at all that we've had about the communications we've sent out previously?
Yeah, both Lynn and I are nodding our heads.
I think you'll recall, Councillor Vickers, we had a resident survey go out for 3,300, and we asked a specific question about the last leaflet, or the first leaflet, and how many people had seen it, and had they actually had the information of how to get support. And I can't remember off the top of my head, I'm not sure if Mandip will, but the percentage rate was really high and very positive around the Community Support Hub.
Thank you for that. Thank you.
Right, so thank you again for everyone attending, and particularly members of the public. I hope this new timing is more convenient, and I wish you a very happy evening and close this meeting.